Hello, everyone. My name's David. I'm a Master of Public Health student here at Eastern Washington University, and today I'm going to be presenting my Applied Practical Experience or APE presentation. So, to begin, we're going to start by covering a brief introduction. Well, I will introduce my APE, the purpose, my APE site, and my mentors, as well as my role as a student learner. I will also talk about my major work products that I completed as part of my APE and the smaller deliverables and activities that were completed to help me develop some of the underlying principles. Um, we'll also follow that by connecting my work products to the CEPH competencies. Mhm. Finally, we'll close with a brief conclusion and a short personal reflection. So, the purpose of my APE was to better understand health literacy and how it impacts healthy outcomes. Um, I have especially been interested in informed consent forms and how healthcare professionals communicate every day with patients. Um, I completed my APE with the Tulsa Health Department, which is a city-county health department located in Tulsa, Oklahoma. I did so under the supervision of the epidemiology department manager, Jessica Rice, or Jess as she likes to be called, and Josh Fuller, who is the epidemiology community liaison. My role as a student and intern was to understand how public health departments create communications and better understand best practices for creating informed consent forms and other written communications. During my time with the Tulsa Health Department, I was also exposed to several other newer aspects of grant management, research, training and design and implementation, and community outreach events. One of our events, I was able to present my project and even got to facilitate a stakeholder listening session. My AP consisted of two major work products, which were a readability toolkit in my presentation, and then the Oklahoma State Department of Health informed consent form reviews and revisions. So each of these products consisted of several smaller deliverables. As you can see here, my toolkit had several health literacy flyers. It had some plain language trainings, the health literacy and plain language PowerPoint presented that or variations of that three different times at three different meetings. Um, and we're not going to be able to discuss each one of them in this presentation, but we'll briefly touch on them a little bit to discuss how they contributed to the overall project. And then my informed consent forms revisions. We looked at the current informed consent forms that are being used by Oklahoma State Department of Health and the county health departments now. And then I applied plain language and new health literacy standards and guidelines, and we graded those for readability, and I made revisions. So the readability toolkit and presentations. So my readability toolkit consisted of a couple different flyers. Was able to collaborate with some other members of the epidemiology department on that, a resource guide, reference sheet, several trainings, and some interactive exercises. But before we get too far into those, there's some few key terms that you need to look at first. So to really understand a lot about what I did, three key terms that you need to know are readability. That's pretty easy. It's just how simple or how easy or difficult something is to read. Health literacy. Health literacy is the ability to receive, process, and understand basic health information and how to, interpret that and bring that into your daily life to make informed decisions and help improve health outcomes. Plain language is very simple communication that is clear, accessible, and easy to use. So while the APE course was only 6 weeks long, my experience with the Tulsa Health Department actually lasted about 10 weeks. Um, each week I met on a rotating schedule with either Jess or Josh. Um, we either met in person or virtually. So I currently work for the Oklahoma State Department of Health, but my AP and my supervisors, they work for Tulsa Health Department. But because the state maintains offices in each county health department, I have an office in the Tulsa Health Department where my supervisors are at. So that made in-person meetings a lot more accessible. Um, each week, I was responsible for a different data review or a research request from one of my supervisors that helped me build upon my knowledge base regarding plain language and health literacy. Those activities led to several different inputs, um, some of which included the previous flyers that I mentioned, a plain language and health literacy resource document. During my time with Tulsa Health Department, I also attended several webinars at the request of my supervisors, and they also asked that I present a brief synopsis of each one of those at either our in-person meetings or some of our team events. So what were the anticipated outcomes for each of these deliverables? Each of the deliverables in the toolkit was really designed to kind of build upon and enhance the overall effectiveness of the toolkit. The more tools you have, the stronger the foundation you're able to build. The the trainings and the interactive exercises were able to help the staff build confidence in using some of the plain language techniques that we introduced when interacting with the clients. Um, the culmination of all the deliverables, and this kind of goes for both work products really, is they help strengthen our public health system by building trust in us as providers and healthcare professionals and promoting positive health outcomes in our communities. So I wanted to include this flyer in my presentation because I thought it was kind of interesting. As public health professionals, we just kind of organize the data and the information. So this is what our flyer looked like after all of our collaboration and everything was completed. The final step is done by marketing, where it goes for the final formatting and they add all the approved graphics because everything has to be approved. They add the approved graphics and put the final branding on it. So this is what it looked like before. Unfortunately, I don't have the digital copy of it to include here. So my second health product or my second work product here is all about informed consent. This is really kind of what first piqued my interest in plain language and health literacy as the topic for my APE. My activities here included obtaining the informed consent forms that are used by our health department. I visited several of the local community county health departments and obtained the forms that were being used. I compared those forms with the ones that are on our SharePoint drive just to make sure that the ones that they're used are the current forms that are available on the drive. I downloaded the PDF source files. The source files were then converted and uploaded into a readability calculator. The readability calculator came from the University of Oklahoma. The data was then organized and analyzed. I created graphs for my charts and my presentations. My outputs here were the charts and graphs that I created from my data. Also, each consent form was rewritten using the toolkit that I had compiled. You can see here, so the consent form here, this is our standard consent form. Everybody who comes into a county health department is going to see this consent form. This is the consent for services, texting and email. This is how the county health department is going to contact you. If it's okay to send you text, if it's okay to email you, they will not release any lab results by text messages or emails. This is just for reminders and things like that. What you can see here, this is our standard consent form for services, testing, and email. Once it was graded through the calculator, this is the readability score that we get. We did this for each of the 7 informed consent forms that we use from the county health departments. Um, this is all of our informed consent forms written at all the county consent forms are written at levels that exceed the recommended reading level of the 6th to 8th grade. If you look at the bottom of the graph, um, actually closer to the bottom, ODH form 1458 is the Nexaplon consent form. Nexaplanon is the implanted birth control device. It actually scores as the most readable consent form that we use. One of the interesting things about this chart here, um, Form 382 and Form 57 are actually WIC participation forms, and those 2 forms scored the highest on our SMOG readability scale. We use SMOG because it's considered the gold standard for healthcare forms. Um, Both these forms had a single legal statement that was 47 words long. The anticipated outcomes for our informed consent form revisions. By creating more readable informed consent forms, we hope to improve patient understanding, increase informed decision making. I removed some of the language to make these forms more culturally competent to enhance patient trust in our county health departments. My overall hope for this project is to support the community by increasing health equity and reducing disparities. So I want to take a brief moment to look at a few specific points of interest on these forms. The document to the left is the current family planning risk and benefit sheet, and the right side are my suggested rewrites. The first thing we notice here is that the current form it's very wordy, and it even looks kind of intimidating to read. But if you look a little closer, you start to notice some of the language that it uses. Oklahoma has more federally recognized tribes than any other state in the country. So, with that being said, we need to make sure that our documents reflect the necessary cultural competencies that our population need. If you notice that the current document mentions sterilization, so this is a big trigger word when we talk about being culturally competent. This is a service that was forced on a lot of indigenous populations as a way to control their population growth. And as a county health department, it's really outdated and really insensitive that we keep it in our current forms. Um, So this is what both forms look like side by side. The left form is still the current version that we use. The right form are my rewrites. Notice how I removed a lot of the dense formatting and replaced them with numbered and bulleted lists. From this view, it's kind of hard to see, but the last sentence in the current document is actually 51 words long. That sentence it's very long, it's very legal, it's very hard to read and understand. Now let's look at how my work products tie into the CEPH competencies. Uh, while most of the work products demonstrate more than one competencies, because I had several deliverables, I tried to match just one product to one competency. So CEPH competency number 7, assess population needs, assets, and capacities that affect communities' health. All throughout this APE, I had the opportunity to interact with community members, different stakeholders, and other colleagues. Through those interactions, I was able to assess different gaps in understanding and of common misconceptions with public health terms. By watching how people interact with staff members, I was able to identify some of the communication barriers that had potential to negatively impact health outcomes. These competencies addressed um, This competency was also addressed through the evaluation of the informed consent forms that I created by the Oklahoma State Department of Health, and that we use in the county health departments. By addressing the communication barriers and ensuring that the documents were culturally competent, the rewritten versions meet current health literacy levels and support healthy outcomes and informed decision making. CEPH competency number 8. Apply awareness of cultural values and practices to design, implementation, and critique of public health policies and programs. By understanding the unique demographics of Oklahoma and the large indigenous populations that call Oklahoma home, ensuring that our documents embody their cultural values is very important. Ensuring all Oklahomans feel safe and valued is important to build trust in public health and ultimately improve health outcomes for everyone. By rewriting our informed consent forms and removing the inappropriate language, I hope to demonstrate awareness of cultural values in public health implementation. Competency number 11, select methods to evaluate public health programs. By using the appropriate evaluation methods, interventions remained evidence-based and appropriate for public health programs. Public health professionals continue to use annotated bibliographies, which was one of the deliverables that I had. It was part of my toolkit. Annotated bibliographies demonstrate sound evidence-based research when evaluating public health programs. Competency number 18, select communication strategies for different audiences and sectors. The Readability Toolkit contains several flyers that were designed to assess the needs of specific populations and provide education to help increase knowledge and understanding of common public health principles. The flyers that we created for future public health professionals was directed toward college students and other academics looking to become employed as public health professionals. CEPH Competency 19, communicate audience appropriate public health content, both in writing and through oral presentation to non-academic, non-peer audience with attention to factors such as literacy and health literacy. So through this, I was able to integrate the competency into my APA through the creation of the health literacy and plain language presentation. This presentation was created with the target audience being the Oklahoma State Department of Health all-staff meeting that we attended at the end of the quarter. I got to present in front of all my peers. So that presentation was altered to meet the needs of several other events that I was asked to present at. I also presented it at the Tulsa Health Department staff meeting and the Community Health Improvement stakeholder meeting. At the stakeholder meeting, I was able to facilitate a stakeholder listening session, which was pretty interesting. So, conclusion and reflection. So this APE and all its opportunities it has presented me has really had a positive impact on both my academic and professional careers. Through different engagements and events, different trainings that I was able to take part of, and different research opportunities, was able to develop skills that will definitely benefit my future goals. As a person with a brain injury myself, this project was very personal for me. You know, it sometimes it takes me a few extra times of reading things to really understand. So seeing that our informed consent forms weren't readable for other people, it's I kind of take it a little personal because this is my employer and this is what I do. Um, so yeah, this is how I kind of got involved in, health literacy and plain language. Um, So throughout my experience, I had the opportunity to create a lot of different documents, a lot of different resources. By training other people, I also hope to kind of help reinforce those principles in myself. When I did my presentations in front of the community members, in front of my colleagues, we really got a lot of, or I got a lot of positive feedback. That was very encouraging. So this was my AP. I very much enjoyed it. I hope you enjoyed my presentation and have a great afternoon, everyone. Thank you.